Hi, Steve from Wandsworth Physiotherapy and Osteopathy. We see quite a number of people with hip and groin problems, and when we assess that area in a sporting population but also in an older population, one of the most common diagnoses is actually with the hip joint. Now there's lots of different pathologies for the hip joint, but perhaps one of the most common is hip joint arthritis. Now arthritis is a condition that is characterized by a loss of cartilage on the ends of the bone. So the hip is a ball and socket joint, so you're going to get thinning or a loss of cartilage on the ball of the ball and socket, and also a thinning of cartilage within the socket. Now what also happens is that there's a loss of joint space, and there's osteophyte build-up around the joint, there's a thickening of the joint capsule and a thickening of the joint synovial fluid. Now this all leads to a stiff and uncomfortable hip, most typically stiff and achy first thing in the morning, and stiff and achy with overactivity. And people often also complain that it's stiff and sore in cold and damp weather for some reason that I think is still particularly unknown. So how do we diagnose hip joint arthritis? Well, there are 4 common risk factors. One is age, and as you age, unfortunately, you do get more wear and tear in the joints. But I've also seen hip arthritis in younger people in their 30s and their 40s. Gender, unfortunately, it is more common in females than males. BMI, the higher your BMI, the more physical load that you're putting through the hip joint. But also, body fat is not an inert substance. It's almost like an endocrine gland. It releases lots of different chemicals and hormones into your system, and some of those chemicals are inflammatory chemicals. And we think now that the more body fat that you have, the more systemic inflammation you have, and this can also accelerate conditions like osteoarthritis. And then lastly, activity levels. If you're underactive or particularly overactive, then it can also affect the hip. So when we're thinking about managing people with hip joint arthritis, if you're underactive and we can increase your activity levels, that alone can reduce hip pain by as much as 10% just from an intervention of exercise. And we might also then want to get an X-ray or an MRI just to see the joint, and we could classify arthritis as mild, moderate or severe. Now in terms of interventions, for mild to moderate arthritis, as I've said, physiotherapy and exercise is a particularly important intervention. And then as are injection therapies. So there are various substances that can be injected, such as a steroid. So that's a powerful anti-inflammatory that if there's swelling and pain in the joint, that can help to settle it down. And then that might be used in conjunction with something called hyaluronic acid. Now that almost acts as like a joint lubricant and helps to preserve the cartilage that you've got left in there. And there's research now showing that PRP might be useful in the hip as well. So PRP stands for platelet-rich plasma. You take some blood from the arm, you spin it in a machine and you extract the platelets and you inject them back into the hip, either on their own or in combination with hyaluronic acid. And the PRP has got 30 different growth and repair factors. So it could act as an anti-inflammatory within the hip, and it might also have some mild regenerative effect. Now, of course, if you've got severe hip arthritis, now sometimes these injections might work, might prolong the requirement for seeing a surgeon or having a total hip replacement. So if you've got hip and groin pain, and it's from sports, or perhaps you're getting into older age and you want to discuss around how you might be able to manage this, then pop down to the clinic. One of the team here will be able to assess you and we'll be able to get you back on the right track to getting your symptoms under control.